Once we get your baseline vitals, your EKG, and your IV started, we will go over a short medical history and surgical history. We will give you an iPad to sign a consent, and the physician will come into this room prior to your procedure. So once we have your consent signed and you've seen the physician, we are now ready to roll across the hallway. You will have an option of walking across the hall, or if you have a condition, we are able to roll you in one of our stretchers. Once you're in our operating room, you will see a bunch of equipment that will be all set up for your angiogram procedure. We'll be hooking you up to a blood pressure cuff. We'll get a pulse oximeter on you, and we will also be placing some stickers on your chest here to monitor your heart rate. We will also be placing oxygen in your nose here to give you supplemental oxygen for the procedure. We will use what's called a conscious sedation, and it is a combination of medications to help your pain as well as calm your nerves throughout the procedure. You will be pretty sleepy throughout the procedure, however, I would be able to arouse you by shaking on your shoulder. Those medications will go in through your IV that we started previously, and then once the physician gets in here, they will be taking a look with our ultrasound machine here at the access site, whether that be on your foot or ankle area, your groin area, or your wrist. Once we get access, we will be using a series of wires to open up your arteries that are needing the attention that may have stenosis or occlusions. We'll get you back into the room that you started in, and we'll hook up the vitals machine again, and we will be closely monitoring your access site as well as your vitals for the next 2 to 5 hours. You will be remaining in this room. During that time, you will be on bed rest here until your discharge time. We will go over discharge instructions for you on how to care for your access site at home, and if you were to come into any complications, on how to approach that. We are excited to see you here, and we hope that this was a helpful video on what to expect for your angiogram procedure.